Hi, my name is Dr. Anne Campbell. I'm a reader in substance use and mental health in the School of Social Sciences, Education and Social Work here at Queen's, and I'm involved in drug and alcohol related research. I am co-director of what's called the Drug and Alcohol Research Network, DARN, at Queen's, and I'm also a member of what's called the ACMD, which is the Advisory Council for the Misuse of Drugs. It's the Home Office independent committee to advise government on the Misuse of Drugs Act 1971. The idea has been floating about for quite a while. I remember seeing on Twitter one of our people who use services had suggested that perhaps, because he and many others are using opioids or heroin primarily, that it would be good if you had a warning system if you were going into or experiencing an overdose, so somebody could come and help you immediately. Sometimes we think we have these great ideas about research and then we ask people to be involved and they think it's a bit of a non-starter. So from the outset we realised that we had to work with people who would possibly use these devices, and what we thought was a really good idea about the wearable, they came up with other ideas to say, well actually that's not going to work. So they had various sort of list of ideas about what it should look like, how it should work, how you should wear it, how you shouldn't be tracked. So yeah, without them we couldn't have sort of got to the stage now that we're at today. I suppose the most important thing with this project, if we get it wrong, then nobody will wear it, or it may cause somebody to not get the help that they need, so we have to be very careful. So this first stage project that we've just finished, which was funded by ESRC Impact Awards, we asked the people to use it for a period of time in a hostel environment and within a prison environment as well. So from there we ascertained that the data, which measures O2 and respiratory rate, could that data be sent directly from the watch to what's called a back-end server at the University of Manchester, which would hold that data very securely within a secure server. And that was successful, so that was the first phase. Lee then, who is the machine learning expert, could create an algorithm about what best sort of represented those patterns and those sort of breathing patterns. Because of that small funded project, now involved in bigger projects to look at a range of life sign indicators. And then we're looking at another project which will take it a bit further, and we're going to start work in a hostel in England and ask people who are at risk of overdose to actually wear it, and that will be linked up again to the same back-end server. The next phase of the project then is to link it up to a response unit, for example NIAS or ambulance service here in Northern Ireland, or workers within the hostel, and then that will provide that warning sign to people so that the ambulance service can come straight to the point where the person is experiencing the overdose. We do not want to be in the position where we could have prevented a death. We made a mistake and that didn't happen, so we have to be very careful as this project grows organically.